Hi, my name is Ellen Claire Arenga, and today I will be demonstrating to you on how we are doing the bed bath. Bathing your loved one regularly is very important way to help to keep their skin healthy. It can help prevent infection, and it's good time to check for sores and rashes. Bathing also help your loved one feel fresh and clean. The amount of help your loved one needs when bathing depends on how well he or she can move. You can be caring for someone who has short-term trouble with self-care because they are recovering from an illness or a surgery. Or you may be taking care of an older person who has a memory problem and can't remember how to battle. Or you can be caring for someone who has a long-term inability to move, such as a person who is paralyzed. This person may need much more help when bathing. In preparation for bed bathing, we need to ask a person if the room is too warm or too cold and change the temperature if needed. Make sure that the bed is high enough so that you don't hurt your back. If it is too low, it is okay to put the knees on the bed to reach over and bath the person. Place a waterproof mat or sheet under the person to keep the bed dry, and for privacy, make sure that the door is shut and the blinds are closed. So we will be placing a Macintosh underneath our patient. This is to prevent from the bed cover from being soiled. In helping someone bath, you may have a chance to check for the skin for redness and sore. Pay attention to the areas with creases, such as beneath the breast or in the fold of a stomach. Also look for the groins area and bony areas such as the elbow and the shoulder. To start with, we need to fill 2 basins with warm water. Use the first basin with soap, wash clothes, and wringing it out. Use the second basin. Use the second to hold clean water for rinsing the soap off. Use the back of your hands or elbow to test the water and to make sure that it is not hot. You may also ask the patient to check it if the temperature of the water is good enough for him or her. You don't have to wear gloves, but it might be a good idea if a person has been vomiting or has diarrhea. And it is a good idea to wear a mask if you are or the person has an illness that can spread, such as cold and flu. Wash and dry your hands and put on the gloves if you choose to wear them. Help the person undress and wash as much as they are able. Remove the clothing only from the area that you are going to wash. For example, uncover the arms, wash and dry, and then put it back into the shirt or gown. We will start cleaning our patient's body from the face. Remove the excess water the S pattern to clean the face, starting on the forehead, the nose, the chin, and going to the backward of the ears. Or you may use the other method, starting from the forehead, the left chin, going down to the neck, and then lastly at the back of the ears. Once we're done, we need to clean the cloth to remove the dirt. And then after that, we can go next to the arms. We can start from the elbow. On the top, side, and then bottom. Once we're done, we can do it on the other side of the arms. And now, we need to clean the patient's body. So, as instructed earlier, we need to remove the gown or the cloth that our patient is wearing. So, to preserve the privacy, we will cover the body with a towel. And then, we need to move the other cloth downward. And then, we will get our towel. And then, we will wipe the body underneath the breast and to the stomach. Once we're done, we need to go to the next part, which is the legs. We need to extend only the first part, covering the genitalia. So first, we need to start, same with the arms, top, side, and then bottom. So if your patient is a female, you need to wear your gloves in doing a perineal care. And also, same with the male. So you can refer it to the demonstration presented for the perineal care. So once we're done cleaning the front portion of the body, we need to assess our patient in turning their back facing the perineum portion of the body. So once they're up on their back, so we need to wash. We need to wash their back. Wash or wipe their back. And then tap to dry. And then once we're done, we need to help our patient to go back to supine position or to their original position. We can also assess or help our patient in changing their clothes, diaper, or any comfortable clothes that they want to wear. Now that we finish with the bath, apply an unscented body lotion or any lotion that the patient recommended. This is to protect the skin and to keep it from drying. Don't put lotion on areas that can become moist, such as under the breast or in the fold of the groins. Help the patient as needed to finish dressing and put away the supplies and wash your hands.